We're ready to go, Madam Chair. We can see you.
Excellent. Okay, I'm not going to hold up the sign then. I'm just going to go ahead into our meeting. The Ramsey County Board of Commissioners meeting is now called to order. Will the clerk please call the roll?
Bretham.
Here.
Mattis Castillo.
Here.
McDonough.
Here.
McGuire.
Here.
Ortega.
Aye.
Reinhardt.
Here.
Carter.
Here. Thank you very much. Commissioner Mattis Castillo has the Pledge of Allegiance for us. We'll all go on mute. Thank you, Commissioner.
I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. We have a full agenda this morning, a workshop in the morning afterward, and another this afternoon. Before we go to our agenda, I'll just ask us to take a brief moment of silent centering and mindfulness. So we'll take that brief moment in recognition of our COVID-19 circumstances and of the multiple incidences which have come our way this past year and a half or so. That moment. Thank you all. The agenda of our May 11th meeting is before us for approval. Is there a motion?
So moved, Madam Chair.
Second.
Thank you, Commissioner McGuire and Ortega. Is there any discussion on the agenda? We'll ask the clerk to call the roll.
Mattis Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye.
Ortega.
Aye.
Reinhardt.
Aye.
Bretham.
Aye.
Carter.
Aye. Thank you very much. The agenda is passed and the minutes of May 4th are before you. Is there a motion?
Move approval.
A second.
Thank you, Commissioners McDonough and Mattis Castillo. Is there any discussion then on those minutes? Thank you. Will the clerk please call the roll?
Mattis Castillo.
Aye.
McDonough.
Aye.
McGuire.
Aye.
Ortega.
Aye.
Reinhardt.
Aye.
Bretham.
Aye.
Carter.
Aye. Thank you very, very much. We have the pleasure. The minutes are passed. And now we have the pleasure of a proclamation in honor of Mental Health Awareness Month. We'll ask that those receiving the proclamation be identified. I'm going to call on the county manager first, and then Commissioner Mattis Castillo has the proclamation. County Manager O'Connor.
Thanks, Madam Chair. There's a whole group of folks. I see Kari joined first, and here come a bunch of others, hopefully both within public health, social services, and some of our community partners who will be joining. And I'll go right to Commissioner Mattis Castillo then to read that proclamation.
Thank you so very much. Thanks all for joining us. Commissioner Mattis Castillo.
Yes, thank you, Madam Chair. And it is my tremendous honor to read this proclamation. Mental health is an issue near and dear to my heart. Right now, while we are all on this meeting, my husband is downstairs working, doing telehealth, providing mental health services for folks. I've witnessed over the last year personally the increase in need and demand for people with mental health services, and thank goodness we have telehealth available for people. This year's theme, Commissioner Fretham is wearing the shirt already. You are not alone continues this year's theme, because though we have been isolated, we are not alone, and millions of Americans experience mental health crises and interventions and need for support. And so this is an opportunity for us to recognize that, along with our community partners and providers, that that we are truly not alone and that we need to destigmatize mental health. I've been very open and honest about my own mental health struggles in the past. And as someone who has experienced trauma and received therapy that is really helpful and work really has put me where I am today. And so thank you for the opportunity to present. We're joined by staff, Sophia Thompson, Charles Goff, Kenya Walker, and Kari Umanzor, as well as community members Tololope Ola, I apologize, Roger Meyer, and June Blue, as I read the proclamation. Whereas mental health is essential to everyone's overall health and well-being, and whereas the COVID-19 pandemic, the death of George Floyd and Dante Wright by the police, and the resulting civil unrest have increased the number of people experiencing feelings of anxiety and depression. Whereas now more than ever, we need to encourage our residents to protect and nurture their mental health and well-being by maintaining a healthy work-life balance, reducing stress, and creating strong social connections. And whereas it is essential to promote mental well-being and learn to identify early symptoms of mental illness in order to receive appropriate health care, safe and healthy housing, economic opportunity, and understanding from community members. And whereas every community member can make a difference by advocating for mental health awareness education, culturally specific and linguistically appropriate services to end stigma, and support individuals and families affected by mental illness. And whereas we all share a responsibility to promote mental wellness and support prevention efforts by simplifying access to care and treatment from the comfort and safety of residents' homes without fear of transmitting or contracting COVID-19. Now, therefore, be it proclaimed that the Ramsey County Board of Commissioners declares May 2021 as Mental Health Month in Ramsey County, and be it further proclaimed that the Ramsey County Board of Commissioners renews its commitment to increasing community understanding of the importance of mental health and to promote the need for accessible, language appropriate, and culturally specific services for all people affected by mental illness. And with that, I'd like to turn it over to the staff who are there to receive the proclamation.
Thank you all for being here, and we are looking so forward to hearing from staff and recognizing staff and community who are here with us. You're on.
Good morning. I'll go ahead and get us started. Thank you very much. We greatly appreciate the opportunity to acknowledge May as Mental Health Awareness Month, as was stated in the proclamation. We are working really hard to think about mental health and meet the community in innovative ways, and really thinking outside the box when it comes to how we serve the community. And so I have the pleasure of working with all the people who are on the call today and others who are really doing some hard work, not only this past year, but in the last several years, in making sure that the community is served. And so we just appreciate the acknowledgement for the work that is being done for the residents. Thank you.
And thank you very much. I see hands of appreciation amongst the commissioners, and I know that also our community shares in our appreciation for the work that, of course, this past year has been so obviously needed, but every year, every month, every day of our lives is needed. We are all affected by circumstances of mental illness and mental health impact in our families and in our communities. And to be able to ensure that the stigma is eliminated so that our loved ones, our friends, our neighbors are able to seek the help that they need without embarrassment, or without feeling as though they are odd or unusual is important. We all have impacts from our mental health, and we all need to be well. I want to thank Commissioner Matas-Castillo for actually sharing with us your trials and your abilities to succeed due to seeking that help. And thank you, Commissioner Bretham, for wearing the shirt that helps us to illustrate that we are not alone. Thank you, Sophia, for your comments. Thank you to all staff who are here with us this morning, and also to our community members. I want to turn back just to make sure that if there is anyone else that wants to make a statement, you're able to do so before we move on. Thanking you so very much for your presence. All right, I will look to see if commissioners' hands are up. I see Commissioner Reinhardt. I'll call on Commissioner Reinhardt.
Thank you. I especially wanted to draw attention to the work that we're doing with co-responding for police calls, because we know that the jails and detention centers across the country are filled with people who actually have mental health issues or addiction issues. But mental health is a huge part of what we are trying to deal with and to help people. So I also really appreciate Commissioner Matos Castillo sharing, and the shirt, "You are not alone." I mean, there are so many things that people just feel isolated in the last year they have been, but especially in the area of public safety and justice, and getting the help that they need at the time that they are in crisis, I think is incredibly important. So in general, obviously mental health for everyone is incredibly important, and seeking the help that you need. But also the co-responding and the model that we're trying to move forward here in Ramsey County with our partners at the local level is so incredibly important. So I wanted to call that out, because a lot of times people don't understand just how much mental health issues tie into what's happening in public safety as well. Thank you.
Thank you, Commissioner Reinhardt. I see no further hands up, and if there are no further comments, the hearts are going up in appreciation for the work that you do and for the relationships in the community that help us to do this work, making sure that people understand what is available and making certain that they're able to access that, and cooperating in the various ways to ensure the very best for our community, that we can all be our very best selves because we're healthy. Once again, thank you so much, and we are all celebrating that work during Mental Health Awareness Month. We have our COVID information. I'll turn to the county manager for that.
Thank you, Madam Chair and members. It's COVID Information Week, so we don't have a full-blown update, but we do have a couple of pieces we would like to touch on. I'll end on the finance piece, but I'll first turn it over to, I just forgot what we call an incident commander, but I'm back. Incident Commander Laura Anderson, who's with us over Zoom.
Hello, Madam Chair, Commissioners, County Manager, Deputy County Manager. Today I have the pleasure of once more introducing some public health colleagues to the board. These are members of our vaccine and testing team, led by Mark Jackson, Carolina Ramirez, and Zitlali Ayala. Mark and Zitlali are here today to accept this recognition on behalf of their colleagues and to share with us a little bit more of their experience in helping residents get vaccinated. If you weren't aware, Mark originally came here in early spring of last year, leaning on his experience with the World Health Organization in East Timor, as well as prior studies in virology. His work around planning and response for isolation housing at Mary Hall was a critical step for us in improving services for homeless individuals who are COVID positive. Zitlali is one of our environmental health fellows. I had the pleasure of watching her interview a few years ago, and one of the many things that struck me about her was her prior work in Dakota County, supporting undocumented families access government resources like WIC. She started out in testing last summer and quickly transitioned into a leadership role. She has pushed us to address vaccine inequities and helped me understand the impact of well-meaning but poorly designed protocol and policy. Both Mark and Zitlali are hardworking, decisive, and passionate about their work and our residents. It is a pleasure to serve with them and also learn from this team, who will be shadowed by our colleagues from the Centers for Disease Control and Prevention at a vaccine clinic later this week. And I'm sure the CDC will learn a few things as well. So I will go ahead and ask Mark to approach the podium if he's there in chambers.
We have him here, Laura. Take it away, Mark.
Morning. Thank you, Laura, for that nice introduction. I can just give a brief summary of kind of what we've been up to. I can briefly touch on testing, but that's not exactly the most exciting thing right now. So mostly I'll talk about vaccines and what we've been doing for vaccine clinics, both our large pod sites and our smaller strike team clinics at a few different interesting locations. Laura mentioned Carl Ramirez and Zitlali. I'd also like to call out Brian Brown and Matt Kudwa, who are also team leaders with us, taking care of a lot of these smaller clinics as we go along. Of course, it's a massive team effort. We can't do this without logistics, without planning, and of course our outreach team, which is really responsible for promoting and getting some of these key populations actually to our clinics or identifying sites that we go to. So far, we've been basically building 2 planes as we fly them. The testing operation was, who would have thought we'd be in a parking lot under tents having people come through and get a Q-tip in their nose. But we did quite a lot with our partners M Health Fairview in that regard, and we also did some testing at homeless shelters multiple times a week. So far, we've given 46,000 plus doses and counting. We've, excuse me, sorry, where was I? So we've started out with a lot of the 1A populations, 1B, 1C, a lot of frontline responders, your paramedics, firefighters, folks like that. A lot of that work in the early going in January wasn't particularly smooth, but as we learned the ropes, we got a lot better at that. And up till now, we were basically doing 1,000-person clinics. In the last couple of weeks, that has really dropped off. The demand has really gone down, particularly as new players enter. The FEMA site, but also the private sector are coming online now with a lot of high-throughput vaccine operations. So we're starting to focus more on some of these smaller sites. Of course, in the early days, we were doing long-term care facilities, as well as some of the homeless shelters. So we prioritized that quite a bit. And we started with the homeless shelter workers, made sure that they were safe, and then we started to do weekly clinics at homeless shelters, mainly Catholic Charities and their satellite sites, but as well as UGM, and of course the ones that we as Ramsey County run at the hotels. So that's been quite interesting. So these days we are trying to get into community centers. The other week we were at the Ormo Community Center. We've been at churches, done a couple of sites at Karen-focused churches, First Baptist Church, Hmong churches. We've been most recently at some mosques, including Darul Uloom. And we also focus on the Latino population at the Mexican consulate, which, as Laura mentioned, the CDC will be visiting us tomorrow. That's a really interesting partnership between the city, St. Paul Fire Paramedics vaccinate there, as well as one of our massive partners, M Health Fairview, and St. Mary's Health Clinics, and the consulate itself. So it's very much a team effort. Been quite interesting to see that roll out. And while I'm on the subject of partners, we can't do this without strong support from our MRC, our Medical Reserve Corps, very much a volunteer-driven effort. A group called Black Nurses Rock, who we started with testing in August. And I actually have a clinic with them later today at Pilgrim Baptist, just over here. St. Paul Fire, St. Mary's Health Clinics, the consulate, a few other ones that I'm sure I'm forgetting right now. But it's been very, very satisfying work. And now we're working to bring the vaccine we're noticing that a lot of people may not be able to get to a big drive-through site like the State Fair site, or maybe the time doesn't work out. So we are doing smaller and smaller clinics and bringing the vaccine to where people are. And we're using some of the data to target those areas of the social vulnerability index. And the one thing that I'd like to pass over to Zitlali while she's on is to talk a little bit about our bigger pod sites and what goes into that, and the just kind of the massive logistical effort that is. So if Zilali's on, could you jump in?
Hello, everybody. My name is Citlali Ayala, and as Laura and Mark mentioned, I'm currently the site manager at the Wellstone Community Center in St. Paul, and I also run the site at the Mexican consulate every other Wednesday. So I'll use the example of the Wellstone Community Center as kind of reference of a little bit of what goes into preparing and just everything that goes into running a pod site. So for the Wellstone Community Center, we are able to hold up to 600 participants, 600 clients. And usually at the site, we would be able to hold more, but due to parking issues at the site, we can't hold anymore. But you know, we do have other sites that can hold more people as well. As Mark mentioned, we do, it's a team effort. We have public health staff who are our leads. So we do have a lead vaccinator, a lead screener, leads for scheduling second appointments, and also leads for doing check-in, for logistics. So that just like all the setting up, welcoming staff to the site. And we do have a lot of volunteers from our Medical Reserve Corps. And we also have interpreters at each site. We try to have a Hmong interpreter, ASL, and Spanish, since we tend to see that that's the languages that we most commonly see with folks who don't speak English that well. And we also use Language Line to accommodate other clients who speak other languages. So we try to accommodate as best as possible with those language barriers. We do schedule second doses. Since we carry the Moderna, we schedule second doses on site. So after the client goes through check-in, screening, then vaccination, they are told to wait 15 to 30 minutes in observation. And there they get the chance to schedule their second appointment. And we use a system called PrepMod. I don't know how many of you are familiar with it or have been able to schedule your appointments through that, but we're able to schedule our clients' appointments through there. We're able to send them reminders about their appointments. We're able to send them invitations to their email addresses. And then they're able to schedule their second appointments as well. And we use this for most of our pod clinics. And then some of our smaller sites like the Mexican consulate, we do a paper-based, and we use the language preferred by the clientele at that site. So yes, I mean, that's about it. Again, there's a lot of planning that goes into it the day before or, months before, as we have seen. And also a lot of team effort that goes into each pod site clinic.
Mark and Zitlali, thank you for those updates. Laura, did you have anything else you wanted to add before I went into care? Okay.
No.
And Zitlali, I'll personally say thank you for your excellent management at the Wellstone site. Having had the opportunity to receive my vaccine there and go through that process, I just want to highlight the operation, and it's representative of every single site that we run, but getting to see the way it runs and looking around at who's there and everyone feeling comfortable. And I got to watch some people meet face-to-face and talk to someone because they wanted to ask a few final questions, and others being navigated through. It was truly a heartwarming experience. The first time through, Laura was there as well to kind of shepherd through and talk through the full site. The second time I came in a baseball hat and a mask and did my best just to blend in and get to observe, and both ways are a great way to get to see those sites. So my heartfelt appreciation to everyone in public health for their continued work and the work ahead. I want to end on a brief mention of the American Recovery Plan funds. If you haven't seen or heard from 1,000 different sources in the last day, yesterday was the day that the first set of federal guidance came out. My email was like just getting nailed with everyone sending guidance points, and I'm sure as commissioners you were receiving the same. I'm not going to go through a full briefing on eligibility today. I actually want to acknowledge in the 18 pages of FAQ guidance, we've only started to truly comb through it. Our partners are doing the same. The Association of Minnesota Counties is doing it. NACO is the National Association of Counties. We will learn a lot more in the days to come. And generally, the initial outline is consistent with what we're seeing here. It's just a lot more detail than that initial framework associated with the legislation. A couple of points I wanted to highlight for the board today. As something we talked about at the board workshop a few weeks ago around the 5 tiers of ways to view the American Rescue Plan funding and how to think about getting to transformative priorities whenever possible. We talked about the time horizon, and there's a little more clarity now than we had when we met then. The money will need to be obligated by, I believe it's January of 2024. I could be wrong on my month, but the money needs to be obligated in 2024, but then does not need to be fully spent until 2026. And we didn't necessarily know that timeline before. And I say that for 2 reasons. One, I think it's important just to know what we're dealing with in terms of timeline, but also because when we think about the $106.8 million, that's the final allocated amount coming to Ramsey County as a direct appropriation, as one part of the ARP legislation. If you think about that over the full 6-year run that the bill is allocated for, that breaks down to just under $18 million a year, or just under 2.5% of Ramsey County's general operating budget on an annual basis. So it's both a lot of money, but when you think about it in the time horizon there, it does need to be a part of a broader whole, and we don't fully understand all elements of the broader whole yet. The state is struggling with the same questions of they generally think they know how much money is coming to them, but how it gets allocated and how it will then be distributed once here remains an open question, and it'll have significant impacts on local governments throughout Minnesota. This is fundamentally different, I'll just repeat again, from the CARES Act, which was the first coronavirus response money during the depths of the pandemic. And that money was $90 million that came to Ramsey County with 9 months to spend it. This is $106.8 million with 6 years to spend it. And so there's clearly a difference in terms of the federal government's view of what local government's role should be in the response, and much of it is to fill in the gaps that the federal response cannot do. And we don't fully know the federal government's response yet. So we're gonna try to take our time and be deliberate in understanding what's coming forward. Again, as we talked about, there may be emergency needs immediately in some select areas that require a request for board action, those tier 1 priorities. We'll continue to work on those and communicate with all of you as we move forward. And with that, Madam Chair, we would stand for any questions for public health or COVID relief funds that we may be able to help answer.
Thank you very much. I see a hand up from Commissioner Maris Castillo.
Yes, thank you, Madam Chair. I just wanted to personally say thank you again to our team. I have had the opportunity to go out on site and witness the amazing work Mark Jackson and his team and Carolina Ramirez have done, both in the testing, but also in vaccines. Like truly it is worth a trip to go watch how community interacts. And when people are coming in, maybe leery or concerned, they are greeted really with compassion and excitement. I've also talked to team members who volunteer week after week after week that tell me the great leadership that we have at Ramsey County. Laura, you have done a fantastic job building a team, and your team really supports you. You know, when you talk to folks on the ground, like, how's it going? This crew should be burnt out, right? They have been working nonstop 7 days a week to make sure our community is healthy, and they keep showing up. They're scheduling on Sundays. They did vaccines on Easter Sunday when the rest of us were enjoying ham. They were in the churches making sure our community were getting vaccinated, and they were doing it with joy in their heart, which is really remarkable and a testimony to your leadership. And I realized in this moment, it's the first time I ever saw Mark Jackson's face, even though we've met and talked many times, because I've always seen him with a mask on. So I don't know if I'd recognize him on the street without a mask. So it's really wonderful. And I just wanted to share that because it really is a testament to our leadership, to our compassion, and that we're doing things differently in Ramsey County. And so our community knows that they truly are our priority in getting the vaccine. So I just wanted to say thank you, Laura, to your team, and Mark and Carolina, who wasn't here, but I know she's working hard. These folks are like truly running an operation that most armies couldn't compete with. And so, and I've experienced both, and it was truly impressive. So thank you so much for all your work and moving forward.
Thank you, Commissioner Mattis Castillo. Commissioner Fretham.
I have the public health question that all excited and anxious parents are ready to ask. When will we have more details about when 12 to 15-year-olds can start scheduling appointments for shots?
Madam Chair, Commissioner Fretham, fan favorite, Dr. Lynn Ogawa is coming to the microphone to be ready to answer this week's medical questions.
Madam Chair, Commissioners, the answer is soon. So the FDA has made their call. The ACIP, though, however, the committee that has to also make their recommendations. So as much as we wish I could say tomorrow, we can't. The good news is the data looks exceptionally good. About 2,200 children, 12 to 15 enrolled in the study, 16 total cases, all in those who were received placebo. Again, symptomatic infections, but the data is very good, very strong. We also expect that Moderna will be following up with its data in the next few weeks, and so we're hoping that we don't just have one option, but that we have more than one option, especially given that, again, Pfizer is the hardest for us to handle as medical professionals. So, my timeline continues to back up. So when I say soon, maybe it'll be even sooner than soon. But my hope is in the next few weeks. Yeah.
Thank you. I have Commissioner McGuire with a question or comment.
Thank you, Madam Chair. And I think this would be also maybe for Dr. Ogawa, but maybe someone else. But just add my thanks and gratitude to all the people that are making all of these great strides. And clearly the CDC thinks we're doing a great job, and so they're coming to learn from us as well. So I'm just so grateful for all the work that everyone's doing. I have a question about getting tested. I mean, I know we're really focusing on the vaccine, and we've almost all been vaccinated by now. But I had some family members that got sick, or got young members that got COVID, and so I wanted to get tested, and it took me like 5 days to set up an appointment. So I was like thinking that, I think I wanted to get tested on Tuesday, and I couldn't schedule anything till Friday. So was I in the wrong place? I was trying to get it at my local CVS. I guess I could have gone down to if I wanted to travel far, I should have gone to the Roy Wilkins, huh? Is that where I should have gone? Okay. I just don't know if there was any other way. I wanted it to be just really quick and local. So I whip over to my CVS, and they're going, nope, you got to register. And the soonest I could get in was Friday. So I felt better after that. So, but I'm just curious if there was any other options, or if that's where we're sending people for a quick test, is to Roy Wilkins.
Madam Chair, Commissioner McGuire, we sort of jumped over some of the testing stuff today, but we have Mark here today who can talk a little more about testing. So he's coming back up briefly to share a few thoughts.
Thanks again. Up until December 31st, we were doing frequent swab testing, including drive-through at the state fair, which we never had. We always had capacity to accommodate people. That contract that we were using from the SCOC went away as they basically scaled up their saliva testing. And so that became the main source of testing in January till now. And Roy Wilkins is your best bet for same-day test. They were closed from April 27th to May 3rd, but they are back on now, and I know that there's no line or anything like that. So you can go in there 7 days a week to get a saliva test, and the turnaround time is less than 24 hours now. The other option for folks who may not want to go down there is on MDH's website, on the Minnesota Department of Health's website, you can actually order a kit, and they'll send it to your house. You do the saliva test kit, and you send it in with a prepaid UPS bag, and same add a day for shipping, but your return time is still under 24 hours, so usually for your result. So that's our main testing capacity right now. Our testing team is also our vaccination team, so we've basically been prioritizing that over testing. We've done a little bit of swab testing at the homeless shelters to help them with some recent cases and outbreaks, but for the most part, we're relying on the state's saliva testing.
I appreciate that. Thank you so much. And if you do use Roy Wilkins, can you drive in and out there, or do you have to go park and then walk in and then come in? You have to, how easy is that? I'm just gonna, for the public, who might be not used to the parking and things.
So it's not drive-through. You do need to go in the building and wind your way around and get in line, but the line is quite short these days. And there is a certain amount of free parking. I want to say it's 150 plus spots. This may be old information, but right at the ramp, and you can just go through the Skyway or walk across Kellogg to just get right in. In November, that line was quite long all the way through the Skyway, particularly right at the open, but now it's quite short. And I think the last couple of weeks there's been under 1,000 people going through in the entire week, so there's plenty of capacity there.
Thank you. Thank you. Thank you very much. I appreciate that.
Commissioner Fretham.
I'll put in my personal plug for the Roy Wilkins site. I am probably farther away from Roy Wilkins than you are up here in Shoreview, but I'll say, because my family needs to test every 2 weeks, my daughter is in in-person school. We have been going every 2 weeks. I do schedule ahead of time. I think one time we waited because we came at the minute it opened. Otherwise, we walk right in. Parking has always been free. You pull into the ramp, you say, I'm here for COVID testing. They let you through, you park. My kids love running through the Skyway. And then we get our tests. They know the drill. We do our spitting, and we get the results the next day. One time we got it the same day because we had gone in so early. We got it by the end of the day. It is fast. It is easy. It is painless. There is not a wait. If you want a COVID test, just drive on down and get it. I can't tell you enough how easy it's been. And this is me doing it with 2 kids. So, and that's a pain for parents, but I'm telling you, it's not even been a problem for us.
Thank you. Thank you very much. Great testimonial.
Thank you. Commissioner Ortega.
Thank you, Madam Chair. My question is, Health Partners has a drive-through testing in Maplewood. Is that still open? And is it open to everybody?
Actually, I can respond a little bit. I know that all of the health systems, but Health Partners especially, yes, does have, I believe, 6 drive-through sites that you sign up online. They report that you don't need insurance, that it is also free. There's one in Oak Park Heights, there's one in Maplewood, one in Bloomington, and Hutchinson, and one other in outstate Minnesota as well. Some of the other health systems also have set up a similar kind, not all drive-through though. But again, the good news is that the health systems have come online with testing and vaccine as well, so that we're not all responsible for everything, and that we work together to help support all of our constituents.
Thank you.
Thank you very much. I believe that is all. I have no further hands up from county commissioners. I want to turn it back to Ryan O'Connor in case there are additional comments to conclude our COVID information session.
Thank you, Madam Chair and members, for the questions and discussion today. I'll just say that the end of the legislative session, which will tie to a later conversation, matters greatly to beginning to understand COVID relief, COVID response, and recovery. So we'll be staying closely tuned into that work because that will help to guide some of our future conversations around ARP funds in Ramsey County.
Well, thank you so very much for the comprehensive information, although we're just in the information session, not a total update. It has grown to be a familiar, of course, topic for us. And we know that all of the information is still online. So anyone that wants additional can go and see that. But we're thankful for greater availability of vaccinations and continuing testing, the direction of the data indicating that we are in a process of growth and recovery beyond COVID, but also mindful that we need to continue our mitigation steps as we look forward even to that herd immunity that will help us to have a greater freedom that we need to continue right now and even beyond that with certain steps that will help to protect us. Masking and social distancing as a primary focus right now. Thank you again to all our staff for the work that you're doing, for continuing to make it more understandable to us as we move forward, and for the organization that is making certain we have a good process of management to get beyond this pandemic. And with that, then we will turn to our administrative agenda. I'll ask Commissioner Matis Castillo to take us through it.
Thank you, Madam Chair. I'd like to move items number 5, our 2021 agreement with Health Partners Administrators for Cafeteria Plan Administration Services, also known as Flexible Spending Account Administration. Item number 6, which is terms of collective bargaining agreements with the technical employee for the year of 2021. Item 7, which is the local option disaster tax abatement. Item 8, property tax abatement. Item 9, amended and restated lease agreement and cooperative agreement with the City of St. Paul. Item 10, Item 10 is the closeout of the Ramsey County Library Shoreview Capital Improvement Program project to partially fund the Ramsey County Library Maplewood renovation project. And item 11, the March 2021 report of contracts, grant and revenue agreements, emergency purchases, sole source, single source purchases, and final payment.
Second.
Thank you. Thank you, Commissioner McDonough, for the second. There is a motion and a second on all items except number 9, which has been pulled. Is there any discussion on any of these prior to our vote? I'll ask the clerk to call the roll.
Matis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Betham,
Aye.
Carter.
Aye. Thank you very much. All those items have passed. And I'll ask Commissioner Reinhardt for a motion on item 9.
Madam Chair, I would like to move the amended and restated lease agreement and cooperative agreement with the City of St. Paul.
Thank you. Is there a second?
Second.
And Madam
Commissioner
Chair, I know that we have a lot in front of us today, and so I will keep this brief. But considering the fact that this issue of the gun range and the noise and just the environmental concerns that are with that site as well, I felt like it was an issue before I became a commissioner. And so it has been worked on for quite some time. And I want to thank the City of St. Paul, the St. Paul Police Department, the City of Maplewood, all the partners in the neighborhood, and just really in general, taking this seriously and trying to mitigate the issues. But I also think that the agreement and our county attorney staff did such a fantastic job of really cleaning things up in an agreement that needed it for a long time, for liability issues, environmental issues. So it had many different aspects to it, and sometimes we tend to look at only one aspect of it, but this was a huge undertaking. The county manager, Ryan, just everyone that worked on this did a great job in coming to a resolution that helps our environment, public safety, and also just the noise from this. And I will tell you, just as an aside, because it was kind of funny, we went into the neighborhood at one point, and there were city council members from Maplewood and other folks that were part of that. And so we knew that they were going to be doing some shooting. And it, you know, it was kind of funny, but not at the time, because when they actually did the shots, there was one city council member from Maplewood that nearly fell to the ground because it was that loud. And so it was something that was a big issue. I know that I don't want to start naming off some of the folks in the area, but everyone really worked together to make this happen. So again, I just wanted to give kudos to all that were involved in something that has taken a long time and was just a lot of work. So I just wanted to say thank you, and I couldn't let it go after, you know, so many years of working on this without giving those kudos. So thank you.
Thank you, Commissioner Reinhardt. And indeed, it was a concern before you were commissioner, and it has required this attention together with staff and our entire board. And we appreciate that work that you have done as well. Are there additional comments on this item? Will the clerk please call the roll?
Mattis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Bretham,
Aye.
Carter.
Aye. Thank you very much. The item has passed, and we can move on. We are going to go on then to our legislative update. Commissioner McGuire.
Thank you, Madam Chair. And I first of all want to always start by thanking our legislative team of Jennifer O'Rourke, Melissa Finnegan, Commissioner Mattis Castillo, and myself, who continue to meet regularly. We meet every Friday to go over the things that are happening. And of course, the big things that are happening now is that we're in the final week of the original session, and they're in conference committees. The plans are, of course, that they're going to not adjourn by their stated date of May 17th, which would be this Monday, but that they will go longer than that to do the work that they really need to do. So it's with that, and the reason that they're going to go long is, of course, because they as have we just received the guidance, the federal guidance on the American Recovery Plan dollars. And so that's going to affect how they allocate their dollars and what the committee targets are for their conference committees. So that's what the legislature is working on, is figuring out what that guidance means to them, and as are we. And so we expect the session will go later. We expect it will. The time that they have to be done by is June 30th, and so we think that that's when they'll go till. The state is actually getting $240 million more than they were expecting, so that's good news for the budget and the things that we're asking for. And our own chair, Rena Moran, Representative Rena Moran, chairs Ways and Means, will be holding hearings. We're confident on all of that. And also, just to remind people that this is the CARES money, or the recovery money, is something that will be going to our cities, our county, our state, and so we're going to be coordinating all of those dollars as we all decide what we're going to allocate. So just continuing to work on all that. Just thank our team, because they've been sending letters to the conference committee members, reminding them what our Ramsey County issues are in each of the bills. And we've done that with public safety, human services, and with and any of the other bills. We've just been working with our conferees to make sure they remember the issues that we are most concerned with. So, and we're very lucky in Ramsey County. We do have a number of our own members that serve on these conference committees. So we have people that are interested in our issues there. So that's good. Just a piece of good news. Our own Representative Jamie Becker-Finn, who happens to be our House delegation chair for Ramsey County, passed a groundbreaking first in the country bill on prison birth policy yesterday. It's on its way to the governor for signature. That means it passed both the House and Senate. It's going to allow incarcerated pregnant mothers to be placed in community settings so they can stay with their babies, which we know is so important to both the mom and the child. And so this is really great work that our legislators are continuing to do. So when we think that there's nothing perhaps moving as fast as we want it to at the legislature, we know that there's work still being done and that issues are being handled. So we're continuing to work with them on getting more issues to be handled, but this was a good piece of legislation. So thanks again to all of our legislators and our staff and everyone who's working on legislative issues, and more to come. The next 6 weeks, the end of this month and June will be busy as we decide how we allocate the recovery dollars. So thank you, Madam Chair. And if anyone else has any, I know many of us were on the NACO call yesterday. I think they broke the lines for the first call. They had to stop taking people wanting to listen in to federal guidance. So then they had a second call, and that one was very well attended as well. I think everybody's anxious to hear what the guidance is, and we're all figuring it out. So thanks, Madam Chair.
Thank you very much, Commissioner McGuire. Yes, I got booted off that first call or never got in, actually. Commissioner McDonough?
Thanks, Madam Chair, and thanks, Commissioner McGuire, for that update. I just wanted to mention something real quick that's been playing out throughout the session here that we haven't talked a lot about. I know you're fully aware, but I just wanted to update the full board here. There's been some concern about the governor and deeds proposed language as far as dislocated workers fund, and then also Representative Knorr, who chairs that committee, and there's been a lot of work around that. Lang has worked with Hennepin and Minneapolis staff, and I've been working with Commissioner Fernando and Commissioner Cotel, and Representative Knorr and Commissioner Grove, trying to get that into a position. AMC has taken a position that affects us statewide on this, and we've worked with the AMC staff on this. But it is kind of a big deal, and I just wanted to make sure it was on everybody's radar.
Thank you. I really appreciate that, Commissioner McDonough. And if anyone else has any other issues, I'm just picking up some of the highlights, but thank you for bringing that up. And if anyone else has any other issues that they'd like to highlight, I welcome that now too. Thank you.
Thank you, Commissioner McGuire, and also Commissioner McDonough for highlighting the Dislocated Workers Fund issue, and so that we can keep our eyes on that along with you. I see no other questions, and so we are going to move on. Before we go to our commissioner updates, starting with Commissioner McDonough, we'll ask for our county connections from County Manager O'Connor.
Thank you, Madam Chair. 2 updates today. One, I sent you the email link this morning as well. I think it's just important to continue to highlight in every way possible the housing crisis facing Minnesota. It's not only in Minnesota, it's not only in Ramsey County, it's a countrywide housing crisis that's been discussed all the way from the president on down. But it is a unique time, and not in a good way, in terms of affordability of housing in our community. Twin Cities Public Television has launched a site in partnership with the Polad Foundation that is focused on this topic from many different angles and dynamics. And I would ask that we continue to do what we can to share this information outside of our walls, to help build support for the ongoing need for more affordable housing that allows everyone to live in this community wherever they would like to live without spending more than 30% of their income to afford to live here. Secondly, I just wanted to mention ongoing work that's been going on around violence prevention. This has been a topic that I know commissioners are deeply concerned about and engaged in. They are hearing from constituents and residents throughout our community. It's been written about at length as well. And I wanted to just briefly daylight some of the ongoing work that has been happening. Every week there's been a meeting that involves a slew of partners, particularly with the city of St. Paul in many ways being the largest city there, just because a lot of the most recent spate of violence that we have seen has occurred in the city of St. Paul, and it has involved the police chief, the mayor, the board chair has been there to represent the board, myself, 2 deputy county managers, the sheriff's office, as well as community partners, the county attorney, and others. And through that work, we have developed an approach to try to work specifically with individuals who are falling outside of a normal systems response working. How do we wrap around county systems to respond to young people who are at risk of committing further acts of violence or vandalism in ways that are significant concern? And we've started by focusing on carjacking, but there are other types of gun violence that St. Paul PD and the Sheriff's Office also discuss, and it's a concern shared by all members around the table. The goal is to move away from asking law enforcement to be the only response at the back end of something bad going wrong. And so through the work, we have been working to design new processes to be able to talk about whether or not, as community members, particularly through the community ambassadors and Healing Streets programs, do we know these young people in the community? And then to ask, is our system actively working with these young people or their families? Are there ways that we can be doing more? It's brought workforce solutions in the room with public health and social services and community corrections. It's moving us toward that idea of a holistic and, whenever possible, preventative approach to well-being to avoid the need for later on law enforcement action being all we are left with. It's involved the police and their support along the way, the sheriff's office and their support along the way, the county attorney's office, and support from there as well. And so I just wanted to take a moment and walk through the specific efforts going on. This has been an every week piece of our work going on right now. I believe it will pay dividends, and I look forward to talking more about the impacts on the ground. But we realize that we need to be shoulder to shoulder with these young people, many of whom, due to COVID, are facing even more dire circumstances than before. And we can either meet them in their place of need or wait for something bad to go on, and we would prefer the former. So happy to answer any questions if you have them, but just wanted to highlight that. Thanks to the chair for being a part of those meetings as well, and thanks to every partner that continues to show up and lead as we build a more inclusive and connected community where violence is not seen as the answer for those who have been at the margins. Thank you, Madam Chair. That's all I have.
And thank you. I do have a number of hands up from commissioners. I would just want to acknowledge the leadership that our county manager has provided during these discussions, acknowledging that we have been preparing work to focus on growing a healthy and nonviolent community, and that from time to time, as emergencies or things of this sort arise and come to us, we could be pulled in a variety of different directions, attempting to respond. My thanks and kudos to County Manager O'Connor for the work that he has done to see the request and the needs today within the context of the work that we have been preparing for, and to ensure that we are proceeding along a direction to build that comprehensive work in ways that will benefit our community and also align with the directions in which we have been working to head together with our communities. So again, a thanks to you, County Manager, for your diligent management. And I know that it has taken a bit of unplanned time to respond in this way. And I'd just like all of you to know that we have had great leadership in that regard from our staff. And so I will call then on Commissioners McDonough, McGuire, and Matas Castillo in that order. Commissioner McDonough.
Thanks, Madam Chair, and County Manager O'Connor, thanks for that update. I've been aware of those meetings, but I appreciate you mentioning them in the update here at the county board meeting, and really want to recognize and thank everybody for the work they're doing, and just recognize that the focus on the carjackings and the violence in our community, the closer it gets to home, the more real it gets, and the more concerned we get as individuals, of course. And the real danger in this is the public pressure or community pressure to move back towards a punishment, removing kids from their homes and our community, which we've got a century to demonstrate that is not the solution to making our communities safer. But it's easy to go there really quickly when things occur in our community. So I appreciate the effort and the courageous leadership from so many people to resist that, but to be able to address the issue of violence head on, because it is real in our community. And it happens every day, and we need people in our community to feel safe. But removing kids from their homes and punishing them has definitely proven to not be the solution to this. So thank you for that work.
Very well said, and thank you, Commissioner McDonough. Commissioner McGuire.
Thank you. I also appreciate your words, Commissioner McDonough. Thank you so much for bringing that up, and I absolutely agree with you. And the data shows that as well, as you said. And thank you, County Manager O'Connor, for all of your work in all of Ramsey County. I just wanted to thank you for the proactive work. We all on this board, I know, we talk about prevention and early intervention all the time. It's part of our values. It's part of what we do when we budget. And I'm just glad that you're calling it out again, that we are always working on this. And I'm just reminded that 25 years ago when I was in the legislature, oh my gosh, it was a long time. Ramsey County was leading in their violence prevention efforts. We carried grants, you know, there was turn off the violence, and you are the one who can make the peace. I think there's still those signs up around the county, but the county has always been leading in these ways, and I'm just grateful that we're continuing to do that, and it is an ongoing effort. And I think that the more that we continue to make it an ongoing effort of prevention and early intervention, that the better our communities, the safer our communities will feel, and the better we'll all be. So just thanks for that ongoing work and for continuing to do it. So thanks, Madam Chair.
Commissioner McGuire. Commissioner Matis Castillo.
Thank you, Madam Chair. Thank you, County Manager O'Connor, for the update. The one player I didn't hear mentioned that I'm concerned about is, in this process of addressing violence in our community, where is the business community? And I say that in particular because I have hot pockets that gun violence and theft occur in my district that are often associated with particular businesses and business types. And we know that we have great small businesses throughout Ramsey County, but we have a few that profit on the opportunity to take from the vulnerable, exploit vulnerabilities, and profit on poverty in our community that adds to this. And so I'm just wondering if we've engaged that community in this conversation to be part of the solution, as opposed to profiting from the violence.
Madam Chair.